Patient Education Lesson 3. This lesson will apply learning theories to healthcare education. Specifically, we will focus on 5 learning theories, including behaviorist, cognitive, social, psychodynamic, and humanistic learning theories, and how the teacher or healthcare provider may use these theories to initiate change. Learning is defined as a relatively permanent change in mental processing as a result of experience. It is the process where individuals gain new knowledge or skills and change their thoughts, feelings, attitudes, and actions. In healthcare, it allows individuals to adapt to demands and changing circumstances, and in school allows the student to gain knowledge to provide care and education to patients. Learning theory is a framework describing, explaining, and predicting how people learn. Clinicians can apply these learning theories to teach new material and tasks, solve problems, change unhealthy habits, build constructive relationships, manage emotions, and develop effective behavior. These learning theories may be applied individually or in combination and may be used in a variety of settings, including work, the classroom, and at home. Things to keep in mind as we proceed through this lesson are: 1. How does learning occur? 2. What kind of experiences can help or hinder learning? 3. What helps ensure the learning is permanent? The first learning theory we will discuss is the behaviorist learning theory. It suggests that learning is a result of connections made between a stimulus, S, in the environment and the individual's response to that stimulus, R, sometimes called the S to R model. To change behavior, there must be a change in stimulus and a reinforcement of desired responses to the change in environment when it occurs. Some of the key terms in this learning theory are motivation, respondent conditioning, and operant conditioning. Motivation is defined as a desire to reduce a drive reduction, such as desire for food, security, recognition, or money. There are 2 ways to change behavior and encourage learning: respondent conditioning and operant conditioning. Respondent conditioning occurs when an organism responds to a stimulus and forms association. Pavlov, with his dogs, was the first to discover this relationship. This can be applied to the healthcare setting, where someone associates hospitals with a particular smell or other stimuli and responds to it each time they are in a hospital setting, even when the stimuli is removed. Operant conditioning focuses on the behavior the organism exhibits and the reinforcement that occurs after the response. A reinforcer, when applied after response, will make it more likely that the response to that stimuli will occur again. It can be in the form of praise, hugs, money, and prizes, for example. To increase behavior, offer positive reinforcements as mentioned. To decrease a response, such as breaking a bad habit, either non-reinforcement or punishment may be used. Another theory of learning is cognitive learning. Its key concepts are focused on what goes on in the mind of the learner. Cognitive psychologists don't offer rewards or punishments like behaviorists, but instead focus on the learner's goals and expectations, which create tensions that motivate them to act. Cognitive learning includes several well-known perspectives, including Gestalt, information processing, cognitive development, and social cognition theories. Gestalt perspective emphasizes the importance of perception in learning, and rather than focusing on an individual stimuli, it assumes that the whole is greater than the sum of its parts. It assumes that people strive towards simplicity, equilibrium, and regularity. This is particularly seen in the healthcare setting, where patients may want simple explanations that relate directly to their circumstances. Information processing emphasizes thinking, reasoning, the way information is encountered and stored, and memory functioning. The stages of information processing are attention, processing, memory storage, and action. Cognitive development focuses on advancements and changes in perception and thinking that change from birth to death, and education is aided by recognizing these stages and organizing information and making it meaningful. Social cognition is the 4th perspective in cognitive psychology and emphasizes the effects of social factors on perception, thought, and motivation. According to this view, clinicians and patients would have differing perspectives, interpretations, and responses depending on their social and cultural experiences. Social learning theory assumes that individuals do not need direct experiences to learn, but that much of learning is by observing other people and what happens to them. It utilizes role models to demonstrate desirable behaviors such as an experienced clinician modeling professional attitudes and behaviors to less experienced clinicians, thereby influencing their behavior. Vicarious reinforcements, which include other people's emotions and determining whether the role models are perceived as rewarded or punished for their behavior, is part of this learning theory. Psychodynamic learning theory, based on the work of Sigmund Freud, has a central principle that behavior may be conscious or unconscious and either comes from the id, which involves our most basic instinct, impulses, and desires, or the superego, which is involved in societal values and standards. When applied to learning, the basic principles of psychodynamic theory are to focus on the learner's personality development, significant childhood experiences, conscious and unconscious motivation, id and ego conflicts and defensive behaviors, and the teacher's role is to listen, ask probing questions, assess emotional barriers, and to make learning pleasurable while working on promoting ego strength. Humanistic learning theories assume that each individual is unique and that all individuals desire to grow in a positive way. Learning in this theory is facilitated by a caring and nurturing environment that encourages spontaneity, creativity, emotional expression, and positive choices. It is best detailed by Maslow's hierarchy of needs. The focus in this theory is on the learner's desire for positive growth, subjective feelings, needs, self-concept, choices in life, and interpersonal relationships. The teacher's role is to provide support, freedom of choice, and opportunities for creativity and spontaneity. Each theory can be used singularly or in combination. Each patient is unique, and some theories may work better than others. Meaningful practice can strengthen learning, and stress may interfere with the process, which is common in the healthcare setting. In addition to psychological learning, the patient may benefit from motor learning as well. Examples are teaching a patient to use crutches or family members how to assist with ostomy care. Motor learning occurs in 3 stages. 1, the cognitive stage, where the learner develops an overall understanding of the skill. 2, the associative stage, where the learner focuses on how to do the skill more consistently and with fewer errors. And 3, the autonomous stage, where the learner can improve speed and efficiency and requires little attention and thinking about the skill. The variables of practice and feedback are useful in clinical practice. They include pre-practice, which involves goal setting, modeling and demonstrations, and practice, which hopefully leads to mastery. Feedback is important to reinforce learning. It can be intrinsic, which arises from built-in sensory and perceptual information when a movement is produced, and extrinsic, which is feedback provided to the learner from an outside source, such as the clinician. Coming back to our common principles of learning: 1, how does learning occur? 2, which kinds of experience help or hinder the learning process? And 3, what helps ensure that learning becomes relatively permanent? We must answer these questions to ensure patients have the best chance at getting the most from the educational process.